My name is Amy McClosky. I'm the mom of twin girls who are 13. I'm the mom of 2 golden retrievers who are 5. And I work full-time as an emergency physician in 3 facilities in the area. And I'm an athlete, and my time in the gym is my stress release, my happy place. It's really important to me. It's also super important to me to be a good mom, and I love my family and my time with my family. I did gymnastics for 14 years and competed for LSU, and during that time I had a lot of lower back tightness to the point I would wake up every single night in the middle of the night. It would be difficult to breathe, it hurt so bad. I ended up getting pregnant with my twins at 33 years old, and somehow things realigned and my pain went away. So I actually had a nice brief time with no low back pain. I think what injured me were kettlebell swings, and I had felt some pain on the right. I thought it was a tight back, and I am a pretty determined person, so I just pushed through the pain. I didn't actually know at that time that it was a herniated disc, but I'm pretty sure that was what it was, because that is what came back later. Moving on to this injury, I made some very bad decisions. Just out of laziness, I had decided to increase my weight by 5 pounds on a deadlift workout just so that I could work out with my training partner who was stronger than me, and we didn't have to set up 2 barbells, we could just use the 1 barbell. And I remember thinking as I was lifting, my form isn't good, this doesn't feel quite right. My back was getting tighter and tighter during the 4 sets that we had to do. At the bottom of one of my lifts, I felt something slip, and it didn't feel right, it did not feel good, and I recognized something was really wrong at that point. I had trouble standing still, I had trouble sitting still, had trouble sleeping. I could only sleep about 90 minutes to 2 hours at a time, and I would have to get up and stretch. I was really affected at work because there was a lot of standing still. When I walk into a patient room, there's not always a chair there, so I would have to stand and talk to them. I would start to feel the pain, and my leg would actually start to tingle like pins and needles. It affected every moment of my life. I recognized at that point that surgery was absolutely necessary. I was referred to Dr. Mahan and was really thankful I was able to get in pretty quickly for an appointment. I actually didn't realize during that first appointment how minimal the surgery was.
For Amy specifically, the options were either an open traditional surgery, something a little less invasive, and then the least invasive, which is that endoscopic procedure.
I found out later that he does a very special surgery that I actually didn't know existed. His is through an endoscope, so it's a very, very tiny incision.
The least invasive possible is an endoscopic procedure. It's a skin incision of about 7 to 8 millimeters, about the width of your index fingernail. We go down there with super precision using X-ray guidance, go down to the exact level, open up just a little bit of window in normal tissue to gain access to the nerve root, and then sneak around, grab the disc fragment, and get out.
I was intubated for the surgery. The surgery itself, I think, was about an hour. I was out, so I'm not 100% sure about that. Was discharged pretty quickly. I went home and took a nap and had no pain. And then my husband woke me up because he wanted to make sure I would be able to sleep later that night. And we went for a walk and actually ran into a friend on the street. And I was nervous because prior to surgery I was unable to stand still for any period of time. And I stood there for 5 to 10 minutes and we chatted, and it was like my first sign that I was going to get my life back. It's going to make me cry. I'm sorry. I have a lovely life now with exercise, and that's super important for my mental health, for my just to reduce stress from my job, and nobody in this journey discouraged me. I think every day I could not have done this before surgery. That thought enters my mind multiple times every single day for the last year. Has this procedure changed my life? Absolutely. Has given me my life back.